Just, if you get a second there, Rex, just a heartness to chase those would be lovely. There's a flush. Move your hands down a little bit further. Right. Do you want me to continue compressions? I can drag it down.
Once I got into it, I was just thinking back, trying to get my rhythms to the right speed, and I was actually surprised at how well I did. You don't have any more drugs or anything?
No.
The CPR certainly is a very physical role.
What I'll do is give you a rest, because you should only do that for about 10 minutes.
Yeah.
Change over if there's enough hands, okay?
No worries. So someone's doing CPR for 10 minutes. They've had a fairly solid work, so we switch it around a little bit where possible.
Beryl's son, David, has been trying to get her to hospital for several days.
She's been slowly going backwards since about Tuesday. She should have been in hospital, actually. She's been stubborn and going.
The heart monitor showed that she was in what we call asystole, which just means there's no response, no electrical activity in the heart at all.
And that's the rest of the atropine? That's it.
We gave her some adrenaline and some atropine, both to try and stimulate the heart.
It's now been 20 minutes since Beryl went into cardiac arrest. Finally, after 5 shots of adrenaline, her heart starts to beat again.
We've got a bit of an output there, yeah. Yeah, you can see a nice chest rise there.
The colour's really gotten good too.
Her vital signs are better, but Beryl's life still hangs in the balance.
I think we'll jump on the chest again, guys.
Beryl has gone back into cardiac arrest. Blake resumes compressions to keep oxygenated blood flowing to her brain.
You going, Blake? You going good, buddy?
We continued to work on her all the way through to the hospital, thinking that she might have been viable, just that we had had a bit of a response to our treatment.
Is that suction still going? Yep. Where?
At emergency, triage nurses take over chest compressions.
It was going quite good there. We got a pulse back for a while. We had good output, and it stopped again.
The team of emergency specialists work on Beryl for half an hour.
Okay.
But as each minute passes, the outcome becomes less hopeful. Finally, any further resuscitation is futile.
Okay, so they had an output, but now they have also lost the patient's cardiac output. So they've just spoken to the family and they've decided not to continue resuscitation. So the patient has actually now just passed on. How are you with that, Blake? You all right?
You know, it's still a bit in the zone now, I guess, but yeah, I think I'm all right with that.
Probably still hasn't sunk in.
Yeah.
As confronting as the death of a patient may be for Blake, it is an unfortunate part of the job and something all paramedics have to come to terms with. It's been a busy Saturday night in Sydney City. John and mentor Jordan try to squeeze in a quick dinner. But tonight, there's not even time for a hamburger. There's been a multi-car pile-up on Sydney's M5.
We got a job.
438, copy that.
20-year-old female still in vehicle complaining of hyperventilating, unknown chemicals and hazards.
This is only John's second motor vehicle accident. Days earlier, at his first MVA, he wasn't so sure on his feet.
Really need to talk me through this, mate.
Yeah, you're right, mate. You're right. It's all fine. So, John, put your goggles on, mate, or put some safety glasses on.
Have you done it like this before?
No.
A week later, John's confidence is growing with his experience.
Pretty chaotic down here at the moment. There's a lot of traffic going by on either side of the road and all the other agencies down here with police and fire brigade and tow trucks, so there's quite a bit going on.
Miraculously, in the 5-car pile-up, only one person is injured.
Nora, my name's John. I'm just going to take your blood pressure and stuff, okay?
Nora was heading out for the night. She was rear-ended when the car in front of her stopped suddenly.
Sweetie, you need to open your eyes, okay? Open your eyes.
Nora appears to have no physical injuries, but remains unresponsive.
You're going to be fine. You're going to be just fine. You're just a bit shaken up by what's happened, okay? I think at the moment she's in sort of quite a lot of shock. She's not talking to us at all. She seems distressed and she's hyperventilating.
Nora's dazed condition is common in many car accidents. She's in a state of emotional shock. At hospital, she'll undergo a thorough assessment to see if there's an underlying condition.
We just need to keep her calm. She's pretty much vitally stable at the moment, so just need to keep her like that and keep an eye on her on the way up to hospital.
John needs to keep a really close eye on her vital signs, try and get her talking a little bit more, but keep a close eye on her heart rate, make sure her lungs are clear and that her oxygen levels and respiratory rate are all normal, yeah, because she could potentially deteriorate as time goes on.
I think she's just in a bit of emotional shock. She's a bit worked up over what's happened tonight, and with good reason. I mean, she looks like she was out on her way out to go for a night out in the town with friends, and now it's ended like this.
That was the second MVA we've gone to. John was much better. He was just much more relaxed.
Similar kind of circumstance, a lot going on, but I think I kind of was able to maintain my focus a bit more on the patient, a bit better, because I knew what to expect to a degree.
A night in hospital undergoing tests and observation will determine whether Nora has sustained any injuries.
How are you, mate?
Coming up, Blake feels the strain of his new career.
I think for me, it's probably one of the harder jobs emotionally.
There you are.
In Coffs Harbour, Blake has just seen a patient die from cardiac arrest. Now he and mentor Paul attend an elderly woman who has suffered a fall.
15 there it is up the front there with the gentleman at the front.
Tens of thousands of elderly people are admitted to hospital every year after suffering falls. Many can be fatal. Every paramedic knows there's no such thing as a simple fall.
Where is our young lady?
Hello. What's your name?
Gwen?
What's happened this evening?
Well, I'm just coming up the hall here and legs just went under.
Okay. And where's the pain now?
Here.
Right. And it's up in the hip itself?
Yeah, sort of feels to be up that way.
Okay.
85-yeold Gwen is no stranger to this type of injury. Only 10 months ago, she had her right hip replaced after a fall.
Okay, just straighten that leg up for me. You're right, you don't move at all. You let me move, yeah?
Oh.
You're right. So just slide.
On closer examination, Gwen's condition becomes clearer.
You look like you might have done that other hip, darling.
Oh, God.
That's how it's sort of looking. Yes, that's how it's looking. We're going to need another crew.
Mentor Paul points out the telltale signs.
Can you see the shortening? Come and have a look down the end here. See how much shorter this leg is than this one?
Oh, yep.
And see how it's rotated laterally? That's generally an indication that there's a fair chance you might have a fractured neck of the femur.
A slip in the hallway has turned Gwen and Bob's quiet Sunday evening into a major drama.
How are you going? We're going to need to take her up to hospital, so I need you to gather up a pension card and just any medication that she's on at the moment.
How are you there, darling? Was that uncomfortable or not too bad?
Not bad.
Not bad. You're a good patient.
Any movement of Gwen's broken bone could cause damage to her nerves and tendons. She is immobilised for transport to hospital.
Okay, so you're reasonably comfortable there, Gwen? You let me know if you need anything more, okay?
Gwen and Bob have been married 41 years. Few times will be as difficult as this.
Oh, dear. How long ago did you get her other prosthesis done on the other hip?
In the June last year,
June last year?
Yeah. Well, this must be.
All too well, eh? Couple of bumps when those wheels locked down, Gwen. There you are.
If it is a broken hip, it'll need an operation. All right, we'll give you a little bit more pain relief and then we'll get you across to the bed and I'll organise the x-ray for you now, love. But I'm afraid it does look, just the way your foot is lying, it does look a bit like it, okay? All right, good.
Husband Bob knows how serious the injury is.
In a lady of her age, yeah, that can be very significant, a high mortality rate actually. Because what generally will happen is the patient will come into the hospital and because they're bedridden for so long, they're more susceptible to getting other problems like clots and pneumonias and things like that. So yes, very nasty for someone of her age.
Let's pop that oxygen off while we get you across, Gwen.
I think for me, it's probably one of the harder jobs emotionally, because you have to consider that this couple's been living independently for many, many years, and an injury like this can almost certainly end those days of free mobility at home, and also may cause Gwen to enter into specialised care in a nursing home as a result of that lost mobility. So that is quite sad.
X-rays confirmed Gwen suffered a fracture to her left femur. She'll be fitted with another prosthetic hip and will hopefully recuperate. After just a week on the job as a trainee, Blake has been thrown in at the deep end.
We have done some fairly difficult jobs in some very difficult circumstances here, and that's certainly been very eye-opening.
But for the former lifeguard, there's no question he's on the right career path.
There's few jobs in the world where you have such great highs and corresponding lows, but yeah, there are a few jobs that I believe that would be as rewarding. There are a few causes that are as great as that of an ambulance paramedic.
Coming up on Recruits.
Stop breathing.
Rainer's first cardiac arrest.
This is the real deal. This guy is in trouble.
A life in his hands.
Stand clear.
Then a very different job.
This sweet old lady just hits me like crazy.
And fond farewells for master and apprentice.